Hello and welcome to a presentation on the ethical dilemma of HIV exposure laws in the U.S. During the early years of the HIV/AIDS epidemic, laws were established in an attempt to prevent further HIV transmission in hopes of controlling the disease. Now, in 2017, we must evaluate the ethical basis of these laws, specifically looking at their efficacy and necessity today. Here's some recent background information on HIV prevalence in the U.S. In 2014, 49% of people with HIV achieved viral suppression through antiretroviral therapy. In 2015, there were an estimated 1.2 million people living with HIV in the U.S., and new cases that year decreased by 5% from 2011. In 2016, there were just less than 40,000 new cases of HIV diagnosed. HIV law was recently in the news when California passed legislation in September that lessened the penalty for knowingly exposing someone to HIV from a felony to a misdemeanor. Supporters of the law argued that our state's laws were outdated and unnecessarily stigmatized those living with HIV and may have actually deterred some people from getting tested. Opponents of the new law suggested it may not be effective, stating that 3 in 4 people do not fully adhere to HIV medication directions. With that said, it's necessary to look further into the history and current status of HIV laws nationally. HIV-specific criminal laws came to be following the Ryan White Care Act in 1990. This followed a young man's unfortunate death, whom it is named after. It required that all states had criminal laws in place to prosecute people who knowingly exposed others to HIV. Since then, 33 states currently maintain a total of 67 laws specific to people with HIV. 28 of these states classify exposing someone to HIV as a felony, and 6 of them include registering as a sex offender part of the punishment. Here's a map that depicts the United States and its respective HIV laws. Related to laws in place for those with HIV are also laws for the healthcare sector. The Health Insurance Portability and Accountability Act, commonly referred to as HIPAA, mandates privacy and confidentiality of medical records. HIV status confidentiality is included under HIPAA and is important for each patient to avoid stigma. HIV is mandatory by law to be reported to the health department in all 50 states. Personal information is removed and the data is used to track the disease so that federal funding can be allocated most effectively. Upholding these 2 laws are a part of healthcare professionals' standard of care, which is the level of performance expected to be carried out based on their qualifications. Upholding standard of care in regards to an HIV-positive patient includes ensuring their legal right to privacy and following the legal obligation to report their case. Understanding the law when it comes to healthcare and HIV specifically is important for a few key reasons. HIPAA, perhaps the most well-known law in healthcare, has been established to ensure a patient's privacy, as well as ensuring the maintenance of health coverage during a job change. These are both important for an HIV-positive person. A breach of this confidentiality can result in legal ramifications, including fines and, at worst, loss of licensure. Legal compliance from medical professionals help to ensure a patient's autonomy, which is a key element of healthcare ethics. Now knowing the foundations of healthcare law as it pertains to HIV, we can address the ethical perspective. There are 3 key ethical perspectives to be addressed. First is the issue of maintaining ineffective laws. We know that public health policies are designed to reduce incidence and prevalence of disease and may sometimes need to trump personal liberty. But studies have shown there's little evidence that criminalizing HIV alters social norms in the HIV community, nor does it deter behavior associated with transmission. It's also been found that perceived responsibility in HIV prevention is no different for those who know their status versus those who do not. And there is no study that has actually seen law reduce HIV prevalence at a population level. There's also the ethical issue of negative impact on public health efforts. Criminalizing HIV exposure may actually be a disincentive for getting tested. Studies have shown that clinician-patient and counselor-patient relationships can be hindered if openness is not fostered, but diminished by stigma. This in turn has shown subtle effects in adherence to medical treatment for HIV-positive persons. Additionally, these laws may communicate unclear information as to what is considered legally risky. Finally is the ethical issue of criminalizing low or no risk activity. Since the 1980s, 20 to 25% of known arrests made in regards to HIV exposure were actually for actions that pose no risk of transmitting HIV, such as spitting or biting. Additionally, laws in place should reflect the fact that there is effectively no risk of sexually transmitting HIV when an undetectable viral load is maintained. This can be met through adherence to antiretroviral therapy and can be sustained through methods like PrEP and condom use. The aforementioned arguments, coupled with these three facts, are important to consider in this issue. When it comes to disclosure of HIV status, it has been proven that personal duty is the primary contributor. Criminalizing HIV non-disclosure today may actually communicate an incorrect understanding of how HIV is transmitted and not taking current medical technology into consideration. Avoiding social stigma is important when it comes to the ethics of health laws and policy and can be perpetuated by misinformation. Therefore, I would argue that the criminalization of HIV transmission is ineffective policy and broadly unethical. It should no longer be implemented for the benefit of those with HIV and for the benefit of continued public health efforts. I would recommend that if needed, laws are already in place in all 50 states that criminalize assault or negligent behavior. These might be used for unique cases related to HIV. I would conclude that a lack of understanding in regards to HIV transmission risks and effective prevention methods can perpetuate misinformation and further stigmas. Therefore, I recommend an increase in national HIV education to benefit those with an HIV diagnosis, those around them, and to ensure accurate information among the public. I would argue that the number of new HIV cases each year has significantly decreased since the 80s, and medical technology continues to advance, which will only further nullify HIV laws. Therefore, I recommend a more robust relationship between the field of public health and policymakers in order to ensure implemented laws are useful and evidence-based. Here are some closing remarks from Barack Obama for your consideration.
It's now been more than 3 decades since the first cases of HIV and AIDS were diagnosed in the United States. For many Americans, those early days of the AIDS epidemic were marked by fear and by stigma, by how little we knew about the disease, by a lonely fight to be seen, to be heard, even to be treated with basic compassion. Times have changed. Prevention, treatment, and care have saved millions of lives, even in the world's poorest countries. Testing and access to the right treatment mean that being HIV positive, once perhaps a death sentence, can still mean a chance at a healthy and productive life. Our work is far from finished. 1 in 8 people with HIV still go undiagnosed. Only 3 in 10 people with HIV have suppressed the virus in their system, lowering it to an undetectable level. And this disease still affects different ages, races, sexual orientations, and even different regions of the country in disproportionate ways. That's why this is the first administration to release a comprehensive strategy on HIV/AIDS, and that's why we are updating it for the rest of this decade. It seizes on the rapid shifts in science and policy as we've learned more about this disease. It calls for widespread testing, full access to services that reduce the risk of acquiring the HIV virus, and guaranteed access to regular doctor appointments. And it focuses on making sure that every American, no matter who you are, where you live, how much money you've got, can get access to life-extending care. We've come a long way in the fight against AIDS, and we can't let up now. For those whose lives are still at risk, and for those who didn't live to see this moment, let's keep working for an AIDS-free generation.
There is absolutely work still needed to be done, but ethical work rooted in education, prevention, and healthcare support, not law. Thanks so much for joining. I hope you enjoyed it. Here are my sources for this presentation.